Well, I want you to take a second and think about how much you use your voice in a day. You talk to your coworkers, your family, maybe even raise your voice a time or two with the kids. Or maybe you need to talk as part of your job, like me. So what do you do if your voice falters? Well, I would like to welcome Dr. James Lowry and Dawn Lowry, a voice pathologist with Ohio ENT and Allergy physician. So thank you both for being with me.
Thank you.
All right, Dr. Lowry, you treat so many professionals who rely on their voices, but really anyone can fall into that category, which I think is strong. Obviously, I talk for a living, but people use their voices on a daily basis, right?
Yes, indeed.
That's it. So,
I do.
Yeah, exactly. So what types of problems are you seeing?
Well, we're general otolaryngologists, so we see all kinds of ear, nose, and throat problems, but Don and I are focused on voice as a subspecialty. So with voice problems, obviously the first thing comes hoarseness, any change in the character or quality of your voice or how you produce your voice, anything that keeps you from communicating clearly. But along with that, we will see in coughers, people with throat clearing, soreness or soreness using your voice, cross over into swallowing problems. Your voice box, which lets you speak, is an amazing device. It lets us communicate and actually makes us human in many ways. It's also what lets us swallow. It figures out how to make air go one way and food go the other way. So because that's the start of your swallowing methods, we get involved with taking care of swallowing problems also.
So you mentioned hoarseness. So how do we know if that scratchy throat, if what's going on is more than just a scratchy throat that's going to last us a couple of days? I mean, is it something where you have to wait a certain amount of time and say, maybe I need help?
You know, really it has gotten to be more than that. And so much of what we as ear, nose, and throat doctors see are common problems, such as the common cold.
Yeah.
We most of these things will clear in 10 days or so out treatment, and when it gets to the point of getting to 10 days or 2 weeks and things aren't better, then it's time to think about getting things evaluated.
Okay, Dawn, that is where Ohio's ENT team kind of comes in, and you have this team approach when it comes to dealing with these things. So explain the exam and the evaluation process.
So when a patient comes in, we have them complete a questionnaire that gives us some idea as to when the problem started. Is it constant? Is it an intermittent type problem? Medications that they're on, we review medical history with the patient. The case history is really crucial to our evaluation. Then we have them fill out some self-assessments in terms of how much does their voice bother them. I might perceive a very mild problem when they come in terms of quality of voice, but it could have significant consequences for the person, especially if they're a teacher or they're in sales or they're a clergyman. All of those, call center people really rely on their voice. So what we would do after the case history is a voice evaluation where we record the voice, having them do different things to see how much flexibility they have in their voice. Sometimes speaking voice sounds pretty good when they come in, but if we're looking at the pitch level, we might detect more problems with that. And then we do an examination of the larynx. And unlike the primary care physicians who may refer them to our office, we have special scopes that allow us to look in the larynx, either going in through the nose or mouth, which many patients come in and are nervous about, but people tolerate it very well.
Okay, good
so
to know.
After that, we present the whole picture to the physicians, come up with a diagnosis, then they take over with their evaluation.
So when you get it, you evaluate and you come up with, I'm sure, options for treatment, right? So what kinds of things can you guys do at your office?
We treat both medically and as the doctor surgically for things that need surgery. A lot of the reason we work together, though, a lot of the treatment for vocal problems turns out to be therapy or how you use your voice, making sure that you are using your muscle. I mean, a lot of people, you and I at times, are vocal athletes, we sometimes like to say, and a lot of is just learning to use the mechanism better or undoing misuse strategies. People get a cold, they learn to overcome the cold goes away, and they're left using their muscles in not quite the right way. You can get infections, so sometimes we're treating with medication, and then there are problems that need something, growth or, hoarseness that lasts for 2 or more weeks. It's important to check on if it keeps going because you can get growth or
Right, something
cancers that
else
need
can
to be
happen.
need to be removed, and so that gets into surgical answers for certain problems. But that's not the majority.
So don't be scared. It all begins with the team evaluation. Come in, see friendly faces like yourself, right? Ohio ENT and Allergy physicians. All the info on screen. Thank you guys for being here.
Thanks
Thank
for
you
having
for
us.
having us.